As a gastroenterologist, I see people every day with digestive health issues who are getting frustrated despite eating carefully, taking their medications, trying all kinds of home remedies. And what many of them don't expect to hear is that their digestive problems might be to do with their morning routine. Gut is highly sensitive to what you do in the morning. In this video, I will explain 4 simple morning steps that I regularly advise, very practical to Indian lifestyle, science-based. If you value responsible and scientific-based gut health advice, please subscribe to this educational channel from Bengaluru Gastro Center. Why our morning routine can determine the gut health. Our digestive system works on what we call as circadian rhythm. It's like a biological clock inside. When this rhythm is disturbed because of late night sleeping, dehydration, stress, wrong eating habits, I see so many people having issues with constipation, gas, bloating, acidity, sometimes lack of appetite, they don't feel like eating properly. Having a morning routine the aim is to support the natural rhythm, not to fight against it. What should one do when they wake up? The first intervention within 5 to 10 minutes of waking up is to have 1 to 2 glasses of either lukewarm or normal room temperature water. Reason is during sleep, our body loses water because we are breathing. Sometimes we are sweating. The colon, large intestine also sucks water from the stool overnight, making the stools a little bit harder. So morning hydration with couple of glasses of water, what it does is it activates this gastrocolic reflex, which means the intestine starts to move as the water gets into the stomach. It improves the lubrication, the moisture in the intestine. So it stimulates the movement of the gut so that it can clear the stool, what is got inside. It also helps dilute the excess of stomach acid. In the empty stomach, there is gastric acid, there is bile juice, and water can help dilute, and therefore you have less acidity. Key hormones like gastrin that starts to stimulate the digestive movement, and motilin that starts contracting, making the intestinal movements all get activated in the morning. One of the mistakes what I see people doing is that they get up, have a cup of coffee or tea first thing in the morning, and some of them are also having biscuits with it. Coffee, tea on empty stomach starts to irritate the lining of the stomach as well as the food pipe. It can also worsen the acidity. Some people put a lot of lemon in their water, so they already have gastritis, acidity, which sometimes by adding too much of lemon citric can worsen their problem. The second important thing to do in the morning is movement. At least 20 minutes to half an hour of exercise. Anything that you want to do, whether it is brisk walking, jogging, stretching, yoga, Surya Namaskar, whatever it might be, some kind of a cardio you have to do. The science behind this is exercise starts to stimulate the movement in our gut, what we call as this peristalsis. It activates this parasympathetic nervous system, which means it switches your body into the digestion mode, reduces that gut-brain stress signal, which means that you will have less bloating, and people, those who have especially IBS, they suffer less. There are plenty of studies that have shown benefit of even 20 minutes of exercise in the morning can increase the stool frequency, improve your overall digestion, improves the gut microbe diversity over a period of time. So you will get the benefits of having a different types of gut microbe, the gut good bacteria. I would not recommend doing very high intensity workup as soon as you wake up or exercising on a dehydrated body. Start gently. You can build it up later. Ensure that you're well hydrated before you start doing a lot of workout first thing in the morning. The third important habit in the morning is proper toilet habit. Do not ignore the urge to pass stool in the morning. Sit calmly 5 to 10 minutes without putting undue pressure. If you want, you can use a footstool. For most people who are using Western commodes, because elevating the feet can resemble that old Indian toilet habit of squatting position, which is actually good. It puts less pressure on the rectum. It kind of straightens that angle at which the stool can be passed much more easily. And try and avoid excessive straining when you don't feel the urge to pass. Certainly don't take mobile phones inside your toilets, which is a common issue nowadays. People are sitting for long periods of time on the commode, scrolling through their Instagram, YouTube and whatnot. Chronic constipation sometimes starts with poor toilet habits, what happens in the morning. So this is really important to address. Fourth, and one of the most important things is breakfast. The first meal really matters. Why is it so important? Because your gut follows the biological clock, the circadian rhythm. The digestive enzymes, they peak in the morning. So skipping breakfast slows your metabolism, worsens the acidity, reflux, bloating. It can also worsen the constipation. You should ideally have your breakfast within 1 to 1.5 hours of waking up. I see so many people in my gastroenterology practice, when I ask about their breakfast, some of them are eating at 10, 11, and they would have woken up at, like, let's say 5:30, 6 a.m. So in between they snack on biscuits, bread. So try not to do this. Go straight for a good breakfast within 1.5, maximum 2 hours of waking up. Having a good combined breakfast, so a formula that is of protein, fiber, healthy fats. For example, let's say omelette with plenty of vegetables, mushrooms. If you want to take South Indian foods like idli, dosa without much oil, have enough dal in the sambar, plenty of vegetables in the sambar, and also have soaked almonds, walnuts, which can also give you fiber as well as the protein. You can have overnight soaked oats with a variety of nuts, including chia seeds, flax seeds. You can have poha with peanuts, have a bowl of fruit alongside it. So protein stimulates the release of this CCK hormone, which helps us for digestion. Fiber that we get from nuts, seeds, whole grain foods, along with the fruit and veggies in the morning, feeds the gut's good bacteria. So this bacteria then produces these short chain fatty acids, which is important. Having early breakfast strengthens your overall digestion because your gut follows a simple daily rhythm. Digestion happens on time. The way the gut can clean itself, can work stronger and more regularly. When you eat breakfast too late or you start skipping the breakfast, the intestine also gets confused. Food can sit in the stomach for longer, and later part of the day you will start noticing a lot of bloating, gas, reflux, constipation, overall feeling uneasy and uncomfortable. The worst breakfast choices is a lot of these cereals people nowadays eat from the supermarkets, which has got varying amounts of sugar. Deep fried foods like baturas, vada, puri, kachori, samosas in the morning, or having only tea and biscuit, it's the worst breakfast choice. Try and avoid refined sugar for breakfast, because sugar, what it does is it makes you feel better, but it gives you sugar cravings in the later part of the day. So in summary, the perfect digestive morning routine that I as a gastroenterologist recommend is water firstly for hydration. Second, movement, physical activity. Some amount of exercise stimulates the gut as well as our brain. Thirdly, establish a daily toilet routine to prevent chronic constipation. Lastly, a well-balanced breakfast that sets your digestion for the day. Remember, your gut doesn't require any kind of expensive supplements, any kind of fancy dietary regime. It just needs the right signals at the right time. So just by following these 4 routine morning habits, you can try for a 14-day challenge and see what difference it will make to you. Please subscribe to this channel for more gastroenterologist-led information on digestive health. Thank you.